Some of you may know Richard Quest as a business editor with CNN. He was diagnosed with COVID 2 months ago. And I am dovetailing his testimony as to what he went through as an individual with some of the recent learnings of COVID-19, which I hope that Professor Christine Carrington could address on Saturday. So I am asking Professor Christine Carrington to come on Saturday. There is a school of thought being developed when we pay attention to it, that people who got COVID-19 are not having the type of robust immunity that they thought initially that they would have, and about the possibilities of reinfection a second time. This is quite disturbing as a policymaker. So Professor Carrington will be here on Saturday to address that. Internationally, we are starting to observe in certain areas a very disturbing trend where the average age of the coronavirus demographic has plunged by 15 years. Initially, most people thought that the elderly population would have been most affected. But two things have happened within recent times. One, the realization that people in their 20s, 30s, and 40s develop a lot of blood clots, have a lot of strokes, cardiovascular accidents, and so on. So it means that people in their 20s, 30s, and 40s are not as immune from this disease as once thought. And now, with the opening up of economies around the world and with more social interaction, the pandemic is now affecting disproportionately people in their 20s, 30s, and 40s. And as I said, the average age in some parts of the world has dropped in a matter of a month by 15 years. That's a very serious development. Coming back to Richard Quest and his personal story, he says he got COVID-19 2 months ago. And he, as a COVID survivor, one of the 6,946,000 persons who have recovered, he is noticing areas of damage within his system 2 months later. He says, in his case, COVID hit him like a tornado. Now, we don't have tornadoes in Trinidad and Tobago, but we know about them. He says he is discovering new areas of damage literally on a daily basis, and he has now become incredibly clumsy. I checked with the chief medical officer just before. What that points to is neurological damage when people get clumsy. He says at times there's a sense of mild confusion. So there's some cognitive damage with Richard Quest. Then he goes on to say his digestive system in particular has become peculiar. Ladies and gentlemen, this is the testimony of somebody who has recovered from COVID. And we keep saying in Trinidad and Tobago, we have to keep on protecting our children and our society from community spread. Because this is the fate that will await us if we let this virus get a grip in the community. Tom Hanks, who you know, also had COVID. He likened COVID in his particular case to World War II. So I am just raising these two persons who have come out and spoken of their personal experience with COVID to show that the virus now, as it affects over 12 million people around the world, that it seems that the long-term effects of this virus are not only in the respiratory system. In the case of Richard Quest, it seems to be neurological and also cognitive with confusion. So as we mark the 12 million case as we mark 547,817 deaths in Trinidad and Tobago, as we notice the plunging demographic affected by COVID in some areas by 15 years, as we see many countries and economies have to reimpose lockdown measures because of an upsurge and flare-up in cases, I just want to remind the population of Trinidad and Tobago that we must continue to be vigilant, and that all the gains we have made over the past 3 or 4 months, we are only now into the 6th month of this epidemic. What is coming out clearly is that what we thought we knew a month ago, we are now discovering more and more. This is a novel virus, and if we extrapolate into the next few months until the end of the year, we do not know what we will learn in September, August, December. We do not know what we will learn then. So that is why we continue to be cautious. This is why at the Ministry of Health, when we have to advise the Minister of National Security on the Honorable Prime Minister, at the Ministry of Health, we continue to err on the side of caution, because there is so much that we do not know about this virus as we go forward. So, Minister Cox, that is the context in which I wanted to put the local response into the international response and to the international trends that continue to amaze and confuse scientists around the world. And I thank you for this opportunity.
Thank you, Minister. At this time, the Chief Medical Officer, Dr. Roshan Parasram, will provide us with a clinical update.
Good morning, Honorable Ministers, members of the media. I'm Dr. Ajay Sirju Singh, members of the viewing and listening public. The clinical update for Wednesday, 8th of July 2020 is as follows. The total number of tests done in the public sector, UWI and CAFA, 5,680. Total number of unique patient tests now stand at 4,244. Total number of repeats have gone up to 1,436. Community tests are now at 1,987. We remain at 133 in terms of the positive cases. Total number of discharges are 117. And we have 8 persons hospitalized at the Cora facility at this time. In our quarantine facilities, we had a significant reduction in numbers, as you would have noted. 290 returning nationals from the Enchantment of the Sea were discharged. Following, all of them have received their 3 negative tests and followed a period of over 21 days in quarantine, both between land and sea. So they have been discharged, and they would be followed up for additional 7 days in the first instance at home, with monitoring from both the county medical officers of health, with daily calls to determine if you have any fevers, if you have any signs and symptoms, as well as with support of the Trinidad and Tobago Police Service, who will be monitoring to ensure persons abide by the quarantine regulations and stay at home. In terms of the other facilities, we now have 142 persons remaining, and these persons are spread between the UE Debe Penal campus, where we have 30, the Chancellor Hotel, we have 17, at the Napa, with the healthcare workers, we have 21 individuals. UE Freedom Hall, we have 45 returning nationals from the Barbados University campus. All of them have received their negative swabs and are due to be discharged today as well, later today. At the Cascadia Hotel, we have 14 persons, and Vision on Mission will remain with 15 individuals. Minister Cox, that's my update for this morning.
Thank you very much, Doctor. Dr. Adish Sirju Singh, Director Women's Health, Directorate of Women's Health at the Ministry of Health, will provide an update on maternal and infant health as it relates to COVID-19. Dr. Sirju Singh.
Honorable Ministers, Chief Medical Officer, members of the media, ladies and gentlemen of the public, a pleasant good morning to all. The Directorate of Women's Health is a unit at the Ministry of Health, and we are responsible for improving the health care of our mothers and our newborn infants. Today I will be speaking on issues related to COVID-19 and matters related to pregnancy and the newborn infant. The information that I will be discussing today will be useful for women who are planning to become pregnant, who are currently pregnant and accessing healthcare, and for those who have recently given birth. It may also apply to their families and their caregivers. About 3 months ago, I would have provided initial information on this topic at this forum. As Honorable Minister alluded, the scientific information continues to evolve. So please remember, what I'm about to say may be liable to change in the upcoming weeks, months, and even years as new information becomes available. Just as an example, in the United Kingdom, they have updated their clinical guidelines on this very same topic on more than 10 occasions since they were first produced. Our priorities at the Ministry of Health for our mothers and newborns at the start of the pandemic, and which are of course an ongoing concern, were the following: to reduce transmission of COVID-19 to our pregnant population and to their newborn infants, to provide a safe, professional, and compassionate care to all clients related to maternity services, and similarly, if anyone came down with COVID-19 who were pregnant, to provide that same high level of professional care. I have a series of slides that I'd just like to show on screen, and I'll just have hopefully the first slide on. And I'm just showing some data that we have been collecting at the Directorate of Women's Health. And this shows how it informs how we plan activities for Trinidad and Tobago. In this slide, I have here the years 2018, 2019, and we have up to May 2020 on this slide. The data for June is being collated and will be on the slide as of next week. What this slide shows is that on average, there are around 16,000 deliveries in any given calendar year at this point in time. It shows also there are three colors for those who can't see the screen. There's a top line, which represents the year 2018. Below that is 2019. And then we have the year 2020 so far. But you can see that for the last couple years, we have actually seen a decline in the birth rate in Trinidad and Tobago in the annual deliveries. About 90% of those deliveries, or a little over 90%, actually occur in the public healthcare system, and under 10% are in the private healthcare sector. The public healthcare sector is also responsible for all complicated deliveries and all premature deliveries as well. The graph shows that during the COVID period so far, we've actually had slightly less deliveries than last year. We have been coping exceedingly well in the system. The graph also shows some trends that are important when it comes to planning at the Ministry of Health. In any given year, from August going into January of the subsequent year, we do see an annual rise toward the end of the year in terms of the number of deliveries. Generally, there are about 1,100 to 1,200 deliveries in the so-called low season, but we have an excess deliveries, 300 to 400 more deliveries during those months. They are our so-called busy periods. So we use this information at the Ministry of Health to make policy decisions. So for example, simple policies such as ensuring that there are adequate staff, adequate supplies to cope with this, help ensure safety during delivery and for our newborn infants. We are also using this graph to make that logical assumption. Many have been asking whether we are going to see an increased number of pregnancies as a result of COVID-19, and we are going to make policy decisions. So we would expect this graph to show a sustained rise February, March, and so on of next year. Can I have the next slide, please? As a result of COVID-19, we are seeing something worldwide. And as Honorable Minister said, we have been spared so far. We do not want to see what is happening internationally and regionally. This is what is being reported. They are seeing an upsurge in adverse maternal and newborn outcomes. And this is not just in those developing countries. It also holds for developed countries. This is what we have avoided well so far, and we certainly do not want to see this. They have had overwhelming of the healthcare facilities. Their staff were depleted. They lacked personal protective equipment and other resources. Patients were unable to access basic healthcare services, clinics, ultrasounds, laboratory services. And Transportation services also collapsed. They did not have an ambulance to get to hospitals. One just has to search the headlines and read about an unfortunate case in Jamaica about a pregnant young woman who had flu-like symptoms, and she had difficulty accessing healthcare. She was shuttled around to several hospitals. Unfortunately, she died, and she didn't even have COVID-19. I am pleased, however, to report that we in Trinidad and Tobago did not experience this. As I said before, all our maternity-related facilities have continued to function and continue to be open for business. There's, of course, some inconveniences. We have to follow the national guidelines. You must wear a mask when visiting your health facility. And just to highlight our improvement in maternity services, for the last 3 years and continuing, Trinidad and Tobago has had a reversal of those adverse outcomes which dominated the headlines. We have achieved international targets for both mothers and newborn infants for the year 2030, some 13 years ahead of schedule. And during the COVID period, we have seen no upsurge in adverse outcomes based on the data we have been collecting. Can I have the next slide, please? So how does COVID-19 affect pregnancy? So far, the accumulated evidence and information remains concerning but still reassuring. The consensus remains that if you are a well woman who becomes pregnant and if you get COVID-19 infection, there is no additional risk to the mother or to her baby. You will be similar risk as that of the general population. High-risk cases. Unfortunately, though, we do have a problem in Trinidad and Tobago, and you have heard many times we speak about the non-communicable diseases. The following women have been found to be at higher risk in some studies: being overweight or obese, if you have diabetes, which is high blood sugar, if you enter pregnancy with a pre-existing medical condition, if you suffer with your heart, high blood pressure, sickle cell disease as examples, and if you get pregnant when you are older. Now, these are young women, I just want to clarify, 35 years and above, but you are considered higher risk. Can I have the next slide, please? I'll now move on to some frequently asked questions in the slide. I believe we may have, yeah. So, you can have a normal delivery if you do not require a cesarean section if you have COVID-19. With regard to breastfeeding, for the first 6 months of life, even if you have COVID-19, breast milk remains the nutrition of choice. You can safely breastfeed as guided by your healthcare teams. There are antibodies which protect your baby, which move from the breast milk to your nursing baby, and these antibodies do not exist in formula feeds. If you are pregnant and have COVID-19, I want to assure you the public and its parallel healthcare systems are fully equipped to manage your case both here in Trinidad and in Tobago. Next slide, please. If you're in the last 3 months of pregnancy, there is a little concern. We have advised healthcare workers, for example, if you're a frontline healthcare worker, and of course, it's a very difficult time to be working in the front lines, but it's very difficult to wear personal protective equipment for many hours. It may not fit a pregnant woman in the last stage of pregnancy. So we are asking them to avoid the front lines. All women should also discuss becoming pregnant with your healthcare provider prior to becoming pregnant. This is a good advice outside of COVID as well. Have a health check before, especially so if you have a high-risk condition. If you are pregnant, please visit your healthcare practitioner early. Do not wait till after the first 3 months. It's a fallacy that we hear all the time. We have some very alarming statistics that we have collected at the Directorate, and it shows that only 60% of patients, that's 3 out of every 5 women, are coming for healthcare when they discover they're pregnant before into the first half of pregnancy. What it means is that 2 out of every 5 women come to us in the second half of the pregnancy for their very first healthcare visit. I will now answer some questions on our gynecological services. With regard to elective or planned surgery that is not urgent, for example, if you have uterine fibroids and require a hysterectomy, for example, these services have resumed at hospitals. There is some catching up to do. You've heard of this before. We have additional screening protocols in place. There's also, we still need to replenish our national blood supply. So I encourage you, please become a voluntary blood donor if you can. The guidelines for this are listed on the Ministry of Health's website. Cancer screening services such as cervical cancer pap smears are available. Vaccines are available. I once again encourage all pregnant women, please ask about the influenza vaccine. Family planning services are also functional. In closing, let me again say thanks to all healthcare professionals and support staff, the management of the regional health authorities, the private healthcare networks, and the teams at the Ministry of Health for ensuring the well-being of our women and newborn. Please, I encourage you, visit the Ministry of Health's website, and the Directorate of Women's Health has a separate web page with official information and useful literature on women's health. Thank you.
Thank you very much. Members of the media, the floor is now open. Remember to identify yourself and the media house you represent before posing your question. We want to give as many of you an opportunity to pose questions to us, but that means in our limited time, we will have to give each media house a chance to get a maximum of 2 questions in. Once we have completed the pool and time allows, I will come back to you. So let us keep this in mind as we begin taking your questions. TV6.
Good morning, everyone. Ministers, head table, colleagues, or Rishi from TV6. My question is to the Minister. Minister, I have with me a correspondence by some financial citizens abroad. They are accusing government of playing a diabolical game with the lives of its citizens stranded abroad.
Hold on, we are not hearing TV6 clearly.
That's my first question, and if you permit me to ask my second question when you are finished.
Are you all hearing me? Hold on. We didn't hear your question clearly. Could you repeat your questions, please? Could we get the 2 questions?
Sure, no problem. I have with me, Minister, a correspondence from citizens stranded abroad. In correspondence, they accuse government of playing a diabolical game with the lives of its citizens stranded abroad. Is there a schedule of return that you can share with us and tell us the priority? And please permit me to ask my second question when you...
Okay, so the Honorable Minister of National Security, as you know, was here on Monday, and he shared what he is looking at in terms of bringing home people based on the number of applications. He did make the point that an application is not representative of a person. One application could be a family, it could be a group. So the government is not punishing anybody. I keep on reiterating. All of these people who find themselves in this position did not ask for this. No one asked for this. COVID came. It is Mother Nature. And we, as a government, we have to respond responsibly. The responsible response is to have a managed intake of our nationals abroad based on the quarantine facilities that we have, so that they could be properly quarantined to protect not only their health, but the health of their families when they eventually go home to them, and the wider nation. So whilst we empathize deeply, we sympathize deeply, we know, we can only imagine what these families are going through. They did not ask for this, but as a government, we have to respond in a careful, measured manner, and the Minister of National Security will, as he said on Monday, treat with all these requests based on the policies that he has set out. So there is no diabolical game, but I do understand how this could be interpreted as that. People are traumatized. We understand that. There are persons trapped around the world who cannot go home for the funerals of their parents. I know of one case in Trinidad and Tobago personally where somebody's daughter died abroad and could not go to his daughter's funeral. These are real situations. There are people around the world who can't go home to witness the birth of their first child. These are real human tragedies all around the world. We understand, and we understand from the people's point of view that they need to vocalize their frustration. And I think by vocalizing their frustration, and the media is quite right to bring it to our attention. That vocalization is a form of therapy in itself. So let us continue to have the conversation, but we are not trying to penalize anyone, believe me.
Okay, you have a second question?
I do, but Minister, just to say...
Is it a question? I think it's stuck. She's stuck. Let's move to ACP and we'll get back to Urvashi for her second question, okay? So let's go to ACP News.
Harry, ACPnews.com. Just as a follow-up to Urvashi's question, we have now 142 people in quarantine, and I think another 45 may leave today. Then, there's going to be sanitization of all these facilities. When next, then, do you think that we can have another tranche maybe of people coming in? And to Dr. Surju Singh, you talk about, the deliveries. Can you give us an idea what are the protocols that are followed when someone, goes into the deliver baby, in terms of, what they have to do, are they isolated, etc. And also, are these protocols also followed and given to the private institutions, and is it monitored?
Okay, the CMO will answer the first question.
Okay, so we expect another tranche. We have gotten communication from National Security indicating that there's another tranche of persons due to come over the weekend. In total, from various countries, in total, just over 100 persons are expected. So that is our next pending tranche of people that will be coming into the system.
Okay, Dr. Surju Singh?
Yes, so thank you for that question. So the question related to isolation facilities and some of the protocols that are observed. Well, yes, we do have, when you enter the facility in the public healthcare system, there you'll find that there is signage and screening areas and so on that are available. Persons with symptoms, persons who have, we have checklists to follow. They will be followed. There's a protocol that happens in all of our public healthcare institutions, the delivery units, where those persons will be channeled into isolation areas where there are assigned staff, personal protective equipment, and all of those protocols are in place. We have had a number of dry runs. This happens on a regular basis. We have practice ongoing as well, so the staff are well oiled in case this happens still. But rest assured it's there. In terms of the private sector, I work very closely with them as well, and they have been asked to refer all private sector patients to the public healthcare systems, and they will be accepted. They will not be turned away. Thank you.
Okay, thank you. We go to 98.1.
A very good Wednesday morning to the panel. Stephen Cummings, 98.1 FM. I'll go quickly with my two questions, one for Dr. Parasram and the other for Minister Dayal Singh. Dr. Parasram, as we continue to look at the behavior of the disease, the goalpost appears to be continuously shifting. A report says the World Health Organization is now admitting that there is the emergence of evidence that the virus can be spread by tiny particles suspended in the air. And this also comes following an open letter from some 200 scientists who had accused the WHO of underestimating the possibility of airborne transmission. Is this latest development cause for concern for the ministry, as it could also affect further safety measures and guidelines? And Minister Dayal Singh, going back to the WHO, there's a concern about the impact of COVID on the global response to HIV. And it says that a new survey showed access to HIV medicine has been significantly curtailed as a result of the pandemic. And some 73 countries have reported that they are at risk of stock outs of antiretroviral medicine. It's also recommending that all countries prescribed ARVs. I'm wondering if we might be at risk of, while we are focusing on COVID-19, we may be at risk of having low stock levels in terms of our HIV response. Thank you.
So I will take the second question first. And I'm really grateful that you raised that issue to me about HIV. So when we set up the parallel healthcare system, you may remember that we said from this platform several times, the reason for a parallel healthcare system is to do two things. One, have a pathway to treat with COVID, and two, have your existing pathway where normal service continues unabated. On the HIV front, we started to re-meet about 2 months ago, CMO. You were involved in that, with the head of HACU, HIV/AIDS Coordinating Unit, addressing our addressing our progress towards achieving our 90-90-90 targets for 2020. What does that mean? We signed on to a UN declaration in 2016, where by the year 2020, 90% of our known HIV population will be known. 90% of them will be on antiretroviral drugs, and 90% of those on antiretroviral drugs will have their levels drop to such a point to consider them difficult to transmit the virus. We never took our eyes off the HIV/AIDS program in Trinidad and Tobago. Never. And I could tell you, in our meetings, which restarted about 2 months ago, we have absolutely no shortage of antiretroviral drugs in Trinidad and Tobago. Our HIV/AIDS response continues to be a success story that gets little or no attention, but I'm glad you raised it. We have had absolutely no shortage of antiretroviral drugs or anything else to deal with HIV. The program continues to be a robust one, and I really thank you for raising the issue. Thank you.
CMO?
Okay, so we're speaking about emerging evidence of aerosolization of the virus. So the premise from the start is that we were dealing with a virus that was spread by droplet infection, similar to TB, similar to other viral illnesses, meaning that large droplets would go if you sneeze or cough onto a surface. Aerosolization is slightly different. From the beginning, we have anticipated that the particles could have been aerosolized in certain procedures. For instance, when you are intubated for anesthetic purposes, if you are receiving as an asthmatic treatment, there's nebulization. You can have aerosolization in those sort of processes. Even in doing a nasopharyngeal swab, when you take a sample from someone, there may be aerosolization in those individuals. And we have recommended certain types of PPE be worn by the staff doing those processes from the beginning. So there has been no change in that regard. However, aerosolization in general increases the rate at which any virus spreads. So there's an increased possibility of transmissibility in the general population. So if it is the case that we are dealing with an aerosolized virus, the public health measures that we have in place need to be adhered to in a much more stringent fashion, especially wearing masks as you go out in public. So it means that we have to be a little more rigid in the way we abide by our public health regulations, but we will keep our eye on what is happening with the aerosolization, I have not seen any particular evidence coming from the scientific sector in Trinidad indicating that we necessarily have aerosolization occurring outside of the settings that we previously mentioned. But we will continue to follow the emerging new trends in terms of the viral behavior and, of course, adapt our public health response as need be. But the most critical one of the lot, of course, is that you wear your mask much more rigidly in close circumstances where social distances are not being abided by or cannot occur, as well as sanitizing of surfaces in a workplace, for example, because you expect that the smaller particles will go further away, they will last in the air for longer periods of time. They can actually, for instance, in an elevator setting, if someone sneezes before, there may be smaller particles lingering in the air for some period of time. So that's the difference between aerosolization and droplet infection, and it is more concerning because it is usually much more, it gives a greater speed of spread of any viral illness.
Thank you. Newsday?
Yes, Julian News from Newsday. Good morning to the panel.
Morning.
Good morning.
Yes, my two questions. Minister Yalsing, you mentioned the issue of funerals. I'm just wondering if there's any policy and or protocols if someone is abroad and dies and they have no relatives to bury them, and vice versa, if someone dies in Trinidad and all their are abroad, if there's any policy for the transportation of the body across the borders. And secondly, for the sports fans, any update on the hosting of ADVERTISE between August and September? That's my two questions.
So I will take part of the question. The hosting of CPL will be announced if it comes off by the Minister of Sport. I can't give you any information on that at this time, and the Chief Medical Officer will address the issue of funerals.
So we're dealing with transportation of human remains across the border. What normally happens is an application is made to the Ministry of Foreign Affairs. The Ministry of Foreign Affairs will then send certain pieces of documentation over to the Ministry of Health for us to vet and refer back to them with a non-objection to proceed. The Foreign Affairs will give the usual approval. With a closed border, there's another step that is added in because the Ministry of National Security also has a role to play in terms of the process. Bearing in mind, two of the critical documents that the Ministry of Health will look at is one, whether there's an epidemic in the country of origin. And as we know, with this global pandemic, coronavirus is across the world. So most of the time, persons submitting those documents at this point will say there's coronavirus in the country of origin. The other document we look at is the cause of death, which will indicate the nature of death, whether it is infectious or non-infectious. The third document, which is of note for the Ministry of Health, is whether the body has been embalmed or not. Embalmed body means that certain infectious diseases cannot survive, and therefore we give our non-objection to the Ministry of Foreign Affairs based on what documentation we receive.
Just to say, at the policy level, we started looking at the Ministry of Health, this whole issue of bringing back bodies, and that is why we have this position. It did not go unnoticed, and about 3 weeks ago, CMO, we started to look at it. So that's why we have this policy position for you now.
Thank you. Guardian Media Limited.
Hi, good morning, everyone. Rashad Khan, Guardian Media. I just have one question for either the CMO or the Minister of Health. Right now, the number of persons allowed to gather is 25, not so?
Yes.
So I wanted to know, can we expect this number to grow at any point, or is this the number that we are going to keep as far as we could see?
Okay, Rashad, you get the prize again from Monday to now. Yeah, that is a reasonable question to ask, but right now we have no firm date to say raise it up to 50. I think the lawsuit notwithstanding from the bars, what happened before the lawsuit came, or the threat of legal action, it told us, or it told me, that people are willing to push the envelope. People are willing to to break the rules. So right now, today, Wednesday, the 8th, I believe, of July, there's certainly no position at the ministry to advise that we take this up, but that could change.
TTT?
Good morning, everyone. At Monday's press conference, Minister Stuart Young indicated that nationals from Grenada were among those to return. This morning, a group of students contacted the newsroom, and they are actually
Seems like TTT is frozen. Okay, TTT is frozen, so let's go back to Overshare TV6.
Yeah, Uvrashi had a second question.
Hi, good morning again. Thanks for the opportunity.
Lovely, loud and clear.
So, Minister, we're seeing that Venezuela is experiencing a spike in its cases. I think the highest spike in 24 hours was recorded a few days ago. And we know essentially that illegal immigrants are entering TNT. We know that some will be detected. I'd like to know how they are medically managed. And for those who are not detected and they do settle into Trinidad, what is in place from a medical perspective in places like Calcutta to detect if there's a rise in cases in TNT? Thank you.
Okay, so I will deal with the policy position and then the CMO could come in. In June of 2019, Cabinet approved a policy position for the treatment, what types of treatment non-nationals and immigrants will get, whether you are illegal or legal. In that document of June 2019, the Cabinet note, it speaks to they will have access to all public health measures, including vaccinations. They will be allowed treatment at the accident and emergency and so on. And the last paragraph of the note that deals with it, it says all other infectious diseases. That is a catch-all phrase, not knowing at the time that COVID would strike, but you want to be as broad as possible. So anybody, any human being in Trinidad and Tobago, regardless of status, whether you are national, non-national, legal or illegal, you are entitled to COVID testing and COVID treatment. So that is from a policy position, and now the CMO could probably go into some more detail.
So over the last few weeks, months, the Coast Guard would have detected a number of persons coming through the borders, both nationals going out and coming back in, as well as migrants coming through. They would have been held at a quarantine site by the Defense Force. Primarily, the day-to-day management would have been done by the Defense Force in collaboration with the County Medical Officer for St. George West. So if need be to have any swabbing done, that would have been done. We do monitoring for daily temperatures, daily signs and symptoms, as we would treat any quarantine individual. So that has been going on for months now and continues to go on a daily basis. So the monitoring occurs just like anyone else. There's no mixing with the general population. In terms of the second part, we have worked with international organizations, for example, I.A.N, to ensure that there's a liaison with the migrant population in Trinidad and Tobago. There has been printing of materials in Spanish and dissemination of those documents very early on. We continue to liaise with them through an effort we had started late last year with regards to vaccines.
Correct.
And treatment in the primary care setting. So we have a liaison already established that we are using to try to reach out to communities, because we know there's communal living that is occurring, and we don't want anyone new to come into those settings and putting those groups at risk as well. So there's that continuous liaison that goes on between the international organizations and the CMOHs, as well as those communities, to ensure that if we do have people with symptoms, we pick them up early, we test and we treat.
Thank you. We move to CLC. I think I'm seeing the name Nadaline.
Are you hearing me?
Loud and clear.
Okay, I have two small questions.
Sure.
Are schools that conduct swimming classes allowed to resume those classes at public pools? And then secondly, given the WHO's trend, is that worrying to Trinidad, and do we see a change in our policies with regards to the COVID rules in Trinidad being more strict?
Could you clarify the second question? You said with regards to WHO trend. Could you say which trend you are speaking to so we could provide you with an answer?
Regards to the airborne trend that they are seeing when it comes to the COVID virus.
So I think the CMO will answer both.
Yeah, so with regards to public pools, we recognize that they are opening. I think the greatest risk being the changing rooms and the way people interact in those small enclosed areas. So we have recommended to certain persons, of course the precautions hold sanitization, if people are ill to stay away. So the same basic precautions. With regards to errors, but we're trying to, as we said before, with regards to children, we are trying to hold everything related to children until September, if that is possible, so that we don't introduce children into that environment. Children going to the beach, or I got this question offline. How is it different that persons go to beaches with children and they're not allowed to go to swimming events, or they're not allowed to go to gymnasiums as groups or even camps? The difference is parental supervision and parental responsibility. So when you go to a personal event, you have that level of parental interaction and they supervise their children directly. You're allowing groups to go out of parental supervision. It creates a different level of risk. So that's the difference between the two. In terms of aerosolization, I believe the measures that we put in place are adequate for now. We keep looking at the news as it continues. The only public health guideline that we may have to change, if there's a complete turnaround in terms of aerosolization being outside of those normal procedures, with interaction of patients, we may have to change the level of PPE that we use in the hospitals. But again, it is something that is very new and changing, and we will continue to look at the trends put out by WHO and make a decision.
Astronaut Health.
Gwyneth Stewart, Astronaut Health News. Good morning, everyone.
Morning, Gwyneth.
Question to Dr. Parasram. Minister Dialsingh mentioned some person experiencing neurological damage as a result of COVID-19. Is there any risk of persons with other viral infections developing neurological damage? And are there any therapeutic or medical measures that can be taken to prevent this?
Yep.
And my second question, I'm not sure who will answer it, but it has to do with the windows of taxis being opened. I apologize for not knowing what is the current restriction. I know at one time we were advising taxi drivers to have their windows open, but now I don't know in this phase, because I've traveled recently in taxis where everyone was wearing masks and the air conditioning was on, and I know on certain websites you see that windows should be open to help with ventilation, and internal air conditioning systems should be closed. So what's our current policy or restriction on this?
So I will take the second part of the question first and then go back to Dr. Parasram. At a policy level, we still continue to urge, once you are out in public, wear a mask. Whether you're in a taxi or not, you're walking down Chancery Lane in San Fernando, you're walking down, you're in the market in Mayaro, wherever you are out in the public domain, especially around people, wear a mask. 2, the closer you are to people, for example, in public transport, the mask becomes even more important and more critical because you can't social distance 6 feet in a taxi. So in a taxi, in a maxi, in an airplane, you're going to Tobago, masks become even more critical. On the issue of ventilation, once you are in a vehicle with other people, especially other people outside of your immediate family circle. So, private vehicle, you're giving somebody a drop. You don't know that person. Put your windows down, wear a mask. Husband and wife in the same private vehicle, you could use your air conditioning. But rule of thumb, public transport should be, unless it's raining or something, natural ventilation. Put your windows down. That has been the public health prescription we have been given from day one, and it still stands. Natural ventilation will help tremendously with stopping person-to-person spread. So Gwyneth, I really want to thank you for raising that issue, and I did miss you for the last couple of press conferences. Nice to see you back.
Okay, so I believe you're asking about other neurological sequelae to other viral illness. That's correct? There are thousands of viral illnesses, all right? So let us start with that. In terms of neurological sequelae, there are certain viral illnesses that will have a propensity to more neurological effects than others. Generally, any viral illness that people get can give them something called Guillain-Barré syndrome, which is a follow-up to that particular viral illness, which is a neurological effect where there's weakness that goes up, ascending muscular weakness. So that happens, and there is specific treatment that can be used for that particular viral illness. We have seen with Zika, for instance, that Guillain-Barré syndrome was much more common than let us say with the common cold. There are other sequelae that people follow beside neurological. For instance, after a normal common cold, you can get a sinusitis, a bacterial sinusitis, which will need treatment with antibiotics. So there are many viruses that have multiple sequelae. Some have more neurological effects than others, but generally speaking, what we're seeing with COVID-19 seems to be that there may be some neurological effects. They may be linked as well to thrombotic phenomenon, because once you have blood clots occurring, they can have neurological effects as well. All right, so that is in view of the question you asked.
Okay, Loop TT, I think. Yes.
Hi, thanks very much. Just a quick question with regard to the mock polling station that was due to be set up, just to see whether the new health guidelines would go well. Just wondering if it went well and whether there's any update on guidelines for that. Thank you.
So yes, the mock station was set up by the EBC yesterday afternoon. We had members of the Ministry of Health being present as well to have a look and see exactly what was going on, and recommendations coming out of it would have been put into our guideline today. We will be sending that guideline to the EBC for their dissemination, onward transmission as they see fit, and of course I believe later today they may be sending out a press release on that particular event as well.
Thank you. I think TTT is ready. TTT.
Good morning. I'm hoping you all can hear me this time.
Yes, loud and clear now.
At Monday's press conference, Minister Stuart Young indicated that nationals from Grenada were among those to return soon. This morning, we had a group of students contact the newsroom, and they're asking whether or not they're actually included in that bunch, and if not, whether or not they can be given some sort of timeline with regard to when they will be brought home. I'm not too sure if you all can perhaps convey the message to the minister.
So yeah, we can liaise with national security, but I believe the students from Grenada would have been included in the group that we spoke of earlier, coming in over the weekend, but I will confirm with national security.
Okay, thank you. We're out of time. We've come to the end of today's virtual media conference. And do remember that the Ministry of Health and the Ministry of Communications are your only credible sources of government information on COVID-19. And as we go, Trinidad and Tobago, please let us remember the gains our country made during this global pandemic. We have been spared the brunt of COVID-19 because of the public health guidelines put in place by the government. This includes, but is not limited to, the closure of our borders. We know that many of you remain outside of Trinidad and Tobago and are anxious to return home. We understand that you would like to be in your familiar surroundings, but the only way we can continue to enjoy some of the relaxed COVID-19 restrictions is if we return our citizens to Trinidad and Tobago in a controlled and managed way. We cannot overwhelm our public health care system. The government's decisions take into consideration the state-supervised quarantine facilities and the health and protection of our population. Do know that the government is also working on repatriating some of our nationals from Grenada. Canada and the UK are the next jurisdictions the government will be looking at. We understand it has been a long time away for many of you, but we are asking you to continue to be patient with us. Anyone wishing to depart Trinidad and Tobago will be granted approval, but you must make your own arrangements. You are asked to send your applications for departure to departexemption@mns.gov.tt. I wish to remind you to wear a mask at all times. No mask, no service. I am Donna Cox, Minister of Communications. Thank you for joining us today as the government continues its efforts to keep the curve flat and beat COVID-19. Stay safe. May God bless Trinidad and Tobago.